Tuesday, the 17th of November. This will be a virtual meeting with remote attendance by councillors and remote access of press and public, and will be held in accordance with provisions of the local authorities and police and crime panels, coronavirus flexibility of local authority and police and crime panel meetings, England and Wales, regulations 2020. So I'd like to welcome everybody to the meeting, and before we have the declarations of interest or minutes, I'd like to take to welcome Dr. Whitney Curry and take the Director of Public Health monthly update in order that Dr. Curry can attend another meeting directly. So can we have your report? Thank you very much, Dr. Curry.
Thank you, Chair. I really appreciate you moving the agenda for me. Just quickly, there's not huge updates. I think lots of the updates are from the mainland, which obviously affects you quite a bit. Just to let you know, obviously you'll have seen, and those of you who are keeping up to date on the government website will have seen our rates have been steadily going up for a few weeks now. Not as much as in other areas of the country for sure, but you can't deny that rates are going up. So just in case anyone hasn't seen it on the government website, we're at 83.4 cases per 100,000 in the last 7 days. About 6 weeks ago, we were roughly around 25 per 100,000. So you can see that it's gone up, and it's kind of spread quite a way around Cornwall at the moment. We certainly aren't anywhere near any other area of the country. We are the lowest in the country in terms of our cases, but certainly there is some spread. And just to let you know, because I know it does have bearing on your residents, and we are very interconnected, lots of this is household transmission. It's not just care homes. It's not just workplaces. This is genuine household transmission, which is why what we need to make sure that we're telling our residents is really, really, really stick to the lockdown now. This is really, really important. Don't go over to your nan's house. Don't celebrate birthdays by going to each other's homes at this point, because genuinely we've got to stop that household transmission. Just to let you know, what we think the reason is why cases are still going up, although we've been in a lockdown for a week and a half, is that generally Cornwall and the Isles of Scilly have been about 2 or 3 weeks behind the rest of the country in terms of seeing cases go up or down. And especially in the mainland, what we saw was the last night before lockdown was a real big party night for everybody. So right now, cases we're picking up are generally a result of people sort of getting in their last fun before a lockdown, unfortunately. And so basically the first 2 weeks of the lockdown are scooping up any of that transmission that happened just before. We're looking at likely seeing cases start to dip down over the next couple of weeks, assuming that everyone gets into the rhythm of following the lockdown as much as they possibly can. So that's a bit of update in terms of transmission. I know my colleague Tanya will talk about things like testing, but to our knowledge, we have no new positive cases on the islands, and I've not heard of any around the country at the moment either in terms of people who've been getting tested elsewhere. So at the moment, no cases. We're continuing to exercise our outbreak plans to make sure that they're very robust. Last week we did an exercise with Alert, and the topic was around Skybus. So we're dipping in and out of different scenarios to make sure that we're still ready to act and enact those plans if and when we need to do so. And it's been really good, and actually still in terms of the learning from when we had our first few cases on the islands, just making sure we're building on that and incorporating that back into our outbreak plans. And that's down to internal comms, external comms, how we work with our partners, and how we engage with you as well. So those are still being exercised. And I think probably the final bit of an update, it's not really an update, but probably more a call to you as the local outbreak engagement board, is that still being able to impress upon your residents, your colleagues, your businesses, that while this lockdown is slightly different than previous ones, it feels like lockdown light, we've still got to make sure that we're following that guidance as much as possible, because although there are a couple of vaccines on the horizon, we can't let our guard down for quite some time, and we've got to still sort of power through this miserable winter period with being as strict as we possibly can. And that's really the only update for me. I'm curious if anyone has any questions or concerns around what's happening these days. Please let me know.
Okay, Dr. Ray, thank you very much indeed for that. I can see Councillor Williams' hand up. Thank you, Councillor Williams.
Thank you. I'll try and keep my questions short. Assuming we come out of lockdown in early December, based on the current figures, would Cornwall stay in Tier 1, or is what you just said, edging towards making it Tier 2? And also in terms of vaccine, I've read there's lots of comments about them being time and temperature sensitive. And obviously time and temperature and sensitive things don't always go to plan on Scilly. Is there much thought being given to how that could be rolled out to make sure it works effectively here?
Thank you, Councillor Williams. Take the first one in terms of what happens if we come out of lockdown in December and whether we go back to tiers. The genuine answer is that we don't know yet. We're not informed yet of what the plan is. We know that although our rates have been quite low, we were also lumped into the national lockdown as well. So we don't know if the national lockdown continues past that expiration date, whether we'll be included in that, and they're not sure yet whether we'll go back to tiers because, as you might have seen in the media, there's some work going on to understand effectiveness of tiers and whether actually we need to be a bit more strict when we come out of lockdown. So we don't know exactly what that roadmap looks like yet, but as we get more information, as we move closer, we'll make sure that we keep you updated. In terms of COVID vaccines, there's lots of reports going on in the media at the moment. There is lots of thought going into what's going to happen for Isles of Scilly and how a vaccine would be distributed throughout your population. So there is a working group specifically for Isles of Scilly, which includes all of those complexities around how the vaccine is managed, handled, how it gets to the islands, what that transport looks like, there's something called the cold chain that you've got to maintain. So you have to keep it at a certain temperature at all times. And so all of that stuff is being worked through at the moment. There's a working group specifically for Isles of Scilly, and also there's a strategic overarching group for Cornwall and the Isles of Scilly, which colleagues of yours sit on, and also I sit on as well. So the plans are working through at the moment. As soon as we're able to share that with you and share that more widely, we'll do that. But at the moment, we're not able to because actually not just day to day, but a bit of hourly things change or update, or we've got to move quite quickly. So nothing is set in stone at the moment, but we'll make sure we get that information out as soon as we possibly can.
Thank you very much, Whitney. Councillor Sims, please.
Hi, Whitney. A couple of questions. Is there a sort of consensus amongst public health directors that we will be out of lockdown in early December? Because it doesn't look eminently sensible for us to come out of lockdown in early December. So the government has obviously got to have a slightly different agenda. That was the first question.
Sure. Thanks, Councillor Sims. I think what we can all expect, vaccine or no vaccine, because the vaccine will take quite a while to roll out, and there's lots of planning involved. I think what we can expect is somewhat of a cycle. Now don't take this as, concrete, but this is what, we in public health kind of assume is the case, is that we'll cycle in and out of either lockdowns or tiers for quite some time, because we can't just lock people in forever, for health, mental health, all of those reasons, and as you say, there are other considerations such as economic well-being as well. So, what we've discussed in public health is this going in and out of certain restrictions for a while. What that looks like at the moment, we don't quite know, but I think we all need to get comfortable with the idea that is the way life is for a little while until this vaccine can get out there and until people trust it enough to actually uptake the vaccine and get it into the population enough for it to be effective. So that is generally the reality we're looking at.
The other question I have is one of the vaccines is extraordinarily low temperature job. Am I right in thinking that it can come out of that 48 hours beforehand? Because I can't see how we're going to get something over here at minus 70 degrees centigrade.
We're working through those details just as we speak. Lots and lots of planning about the logistics of getting it over to the aisles, how we make sure that we store it safely, when it needs to be taken out, etc. It's all very fluid at the moment, but we're making sure that we do it as safely and quickly as possible.
And yes, it's a statement. I mean, I must admit, I'm not seeing many people at the moment, but I imagine people will think, oh, there's a vaccine around the corner, we'll be fine now. But it's essentially, we should just carry on as if the vaccine doesn't exist, because it effectively doesn't at the minute, does it?
Yeah, and although, we're getting lots of rumblings from government that, vaccines are ready, they're planning, we're getting it there, we've got to make sure we're ready to deliver it when it's in our hands. But, timelines change, situations change, so, we've got to just make sure that we're doing what we can prevention-wise until we know we've got it. And even then, as it rolls out, it will take some time for that immunity to get into the population. Even after you've gotten your jab, there's a bit of lag time as well. So we've got to keep doing those prevention activities and protecting each other as we go.
Thank you.
Thank you very much, Dr. Curry. Is there anybody else waiting to come in, please, with a question for Dr. Curry? No. Well, thank you very much indeed, Whitney. We're very grateful for your update. I know you've got to go off and talk about vaccines some more now. So, whenever you need to exit us, then please do so, and we'll carry on with our other agenda items. Thank you very much indeed.
Thank you.
Stephen Taylor, you wanted to come in?
Yes, thanks, Sharon. As we started the meeting, shall we do the roll call so we are clear from the minutes for the minutes and who's here and who's given apologies and all that kind of stuff? That will be helpful, I think, Sharon. Okay.
I'll leave that in your hands then, Stephen. Thank you.
Certainly. So if I just call down the list of members of the committee, that will, and then if you could signify whether you are on the line, that will be helpful. So I shall go in order. Captain Clark? No.
Good morning. Yeah, I'm here. Yeah.
Good morning. Chairman, Vice Chairman, Councillor Van Grottick?
Present, thank you.
Thank you. Amy Langdon?
Yes, good morning.
Councillor Harry Legg?
Yes, good morning.
John May?
Yes, here. Good morning.
We've had Dr. Curry and Councillor Joe Williams.
Yep, here.
Thank you. Is there anybody that I've not mentioned yet of the members of the committee in case I've missed any? No? Okay, thank you. Thank you very much indeed, Chairman, for that.
Stephen, you didn't mention me. Steve Sims.
Oh, sorry. Sorry, you're not on the list. I do apologise. Councillor Sims.
Yeah, he's a later addition to the board.
Yes. Yes, we'll get that on the website as well. And we are all 4 members of the public, are we not, Tom?
Thanks, Stephen. Yes, it's being broadcast on Facebook.
Thank you very much indeed, Sharon.
Thank you.
Sorry, Stephen, did you call Darren White as well? I believe he's on the call.
Let me have a look. I don't think I did.
No. Good morning, everyone.
Good morning. Good morning. Thank you for that. And also, can that be put on the website as well, please, Andy, so that we've got a complete list of members? Thank you.
Okay, thank you very much for that, Stephen. So we'll move on to, first of all, to item 1 on our agenda, which is declarations of interest. Do we have any declarations of interest, please? No, thank you. Item 2 on our agenda is the minutes of the previous meeting. I do have to say, though I would like to have chaired your last meeting, unfortunately, I had to be absent, and it was chaired, thank you very much, Councillor Grottick. It was chaired by our Vice Chairman, Councillor Grottick. So that needs to be entered in the minutes, please, Andy, because I wasn't in attendance at the last meeting. Are there any other items to do with the minutes, please? Anybody got any corrections to the minutes? Councillor Grottick? Councillor Grottick, you put your hand up? You're on mute, Councillor Grottick.
Sorry, Chair. No, I haven't got a hand showing. I didn't intend for there to be one.
Sorry, I thought, or somebody else put their hand up then over your picture. Anybody else wanting to come in on the minutes, please? No? Okay, then unless there are any objections, we will take those minutes as read. Thank you. Item 3 on our agenda is the local outbreak and evacuation plan monthly update, which is in the hands of our Chief Executive, Paul Masters. Thank you, Paul.
Morning, Chairman. Morning, everybody. Whitney's covered quite a lot. Only other things just to bring to your attention, really a bit wider than just the outbreak and vaccine issues, is one. This week we will be trying to distribute again some business support grants, which you might have heard of in our communications. Some of it is business rate related, which is the national grants that will be paid by our colleagues in Cornwall. And the second is we have a discretionary fund of £44,000 that we'll be trying to pick up those people who weren't eligible either the first time or we only got limited payments the first time. Our estimates are that may well come out if the same sort of number come forward again at about £900 per business. So it's not massive, but every little bit helps, I'm sure. The details on that will be coming out this week. Second is that I see in Cornwall there's now a trial of allowing some visits to care homes in a safe environment to try and get that process sorted out before Christmas. So it may well be that visits to the care home may well be allowed this side of Christmas, but the trials are currently being planned this week to see how they go in Cornwall. The next thing is you might have seen some guidance that came out about university students returning and the fact that they need to have 2 negative tests before they're allowed to travel in a 1-week period. I've asked the question of the Director of Public Health, and they're currently looking into that, about what about our under 18-year-olds who are on the mainland at secondary accommodation, and if they test positive, do we use the evacuation process to get them home if they're not able to? I'm still awaiting an answer for that. I think that would be an affirmative, because of course the university rules at the moment is that they need to isolate where they are, and that would cause us a safeguarding issue, particularly with people under 18 years of age. So we're looking into that one. Mike and his team are continuing to do the spot checks on enforcement. We had some further resources given to us to carry on those checks, so that's currently ongoing. And in terms of reverse evacuation, you know that we did have the helicopter and the jet boat, which we announced back in the summer. Recently, the Skybus have now made one of their planes COVID secure as well, in terms of bringing positive cases back. So we have a third sort of string to our bow, if you like, in order to try and get people back if we need to through the winter. And we're going to amend our current scheme, which, as you remember, was to get tourists off the island back to the mainland. We need to formalise the scheme about how it will work in reverse. We haven't had to use the scheme at all during the summer, so those funds are still available. And lastly, from me, Chairman, is there's been a lot in the media about track and trace. You'll know that the national system, I think, has been round about 60% effective in terms of finding individuals, whereas where local government have stepped in and are doing it, it's up to 99%. So it sounds like nationally there's going to be a move for track and trace to be moved much more down to a local level, We're already doing quite a lot on that at the moment. Tanya might want to mention some of it, but more of the responsibility, I think, is coming the way of local government, because we've been proven yet again to be much more effective with local knowledge and being able to get there quickly, which of course is the key. Tanya, did you want to come in particularly around any of the testing things through the winter?
Yes, thanks, Paul. So as we're now entering the winter period, our winter testing plan is in place. It's going well. We've recruited a new mobile swabber, which is really good news. So you might see him out and about. So he's swabbing symptomatic and also pre-procedure routine samples. The usual caveats still apply. So obviously the weather is a big hindrance to us, and just on Saturday we were struggling to get swabs off. So testing is going well. It's going smoothly. But the weather is always against us as we go into winter, so please just bear that in mind. As Whitney has already mentioned, we are still running the local incident response team, and we're operating exercises. So just last week, we tested the Skybus scenario, which was incredibly useful, I think, for everybody on the call. We actually tested what we do in terms of if a family of 4 travelled back from the mainland to the islands and tested positive within 24 hours of arriving, and how we deal with that situation. So that led to good learning, good discussions around processes and communications that we've all taken on board and set actions to follow up with. Another thing to just touch on is obviously the vaccine, and we're working with colleagues and with Whitney and with Public Health Cornwall to determine what we can do to help when it arrives. And whether the multi-agency forum can help in any way in terms of the delivery if we need to, so we're covering all our bases, and how we work with NHS colleagues on the island as well. That's probably it from me.
Thanks, Tanya. And just to add to what Tanya just said, to be very clear here, whilst we're in the game of helping, particularly around the vaccine distribution if it arrives and when it arrives, this is very much an NHS-led project, not a council-led project. That's been made very clear to us all the way through. So what we're doing is offering support from a logistics point of view, but it needs to be an NHS-led project. Thank you, Chairman.
Thank you very much, Paul and Tanya, for your report. Are there any questions, please, on this update? Councillor Williams, thank you.
Thank you. Paul alluded to the work around returning post-16 students and university students, which is obviously hugely relevant to all on Scilly. So I could just ask, as that piece of work evolves and emerges, that we're kept as informed as possible, so that we're going to be asked by parents and young people themselves potentially. So that would be really helpful. And also in the minutes it referred to maybe having a rapid testing kit on Scilly. I wondered if there was any progress or whether that was something still being explored.
I think Tanya will come in on the rapid testing kit. In terms of what I said, Joel, just to be clear, university students, as I understand it at the moment, is you have to have 2 negative tests and then you can travel home, when there's going to be a 7-day period when that's being planned nationally. If you test positive, though, you have to stay where you are as a university student. You don't travel home, which is a difference, if you remember, from the past, where when you were positive, you were encouraged to go home. That doesn't look like it is the case for university students this time. I was referring specifically to under 18-year-olds, because, of course, a lot of our students go to the mainland for their A-levels, and therefore they are minors, in my view, and I know they stay with various families, etc. But if our parents can't get to the mainland to look after them, in my view, that's a safeguarding matter, and we need to assist them to get home. So I've asked Public Health for that specific example to be explored. So just to be clear, but what I will do is take away an action to get some real clarity on that point for the board and for the public, so we're clear about what we can offer and where the rules are. In terms of the rapid testing kit, Tanya?
Shall I jump in there? Thanks ever so much, Paul. So yes, we are continuing to push for the rapid testing kit. We're in discussions. There's a weekly testing group that meets that Abby Wrigley sits on, and every week she's pushing it. So we haven't forgotten it. We are pushing it. But in the meantime, the winter testing service is working as well as it can be.
Thank you. Thank you very much. Are there any other questions on this update, please? Somebody, I'm not sure who it is, but somebody's wanted to come. John May. Good morning, John.
Good morning, Chairman. Chairman, I was just wondering whether or not there was anything we could or even should do on communications for these students who are about to return home, as it probably puts the islands in arguably the most vulnerable position it has been, even at riding above the summer tourist season. The testing for these students, as I understand it, the 2 negative tests, is quite a high percentage that may not be picked up. Is it worth any additional communications with the individual families of students, just to heighten their awareness of potential situations?
I think if it's okay, Chairman, I'll come in on that one.
Yes, please, Paul. Sorry, I was waiting for that.
Yeah, I mean, I think we were intending to do a bespoke piece of communications to parents directly, because I think the rules are a bit confusing and complicated. They're not massive numbers, so I think rather than the general comms on that, we think it's probably best to actually, get in communications with individual families. So we will be picking that one up.
Excellent. Good idea. Thank you very much.
Thank you very much, John, Paul. Any other questions, please, on this update?
Yes, Robert, just a quick one. It's quite an odd thing to do, isn't it? Introducing whoever it is, a student between 16 and 18 with COVID to a house without it. Which is effectively what we'd be doing. It seems that I can see why you'd want to do it on a safeguarding basis, but logistically it's a bit problematic, isn't it?
Well, as my son's one of
don't like the kids.
Right, Amy.
If I could jump in there. As my son is one of these students, I'm very lucky he's in a great house, and they have said that if he tests positive, he's welcome to stay with them if he needs to. But obviously, as a parent, I would like him to be with me, whether I'm with him over on the mainland or whether he's back here with me. I mean, I'm not fussed, but, we need to have something in place. It's all a little bit vague. It's all a bit weird at the moment, them just sort of being away as it is, let alone, if they become ill. So we do need something in place, definitely. And if he has to come home, then, so be it. Obviously, we will isolate with him while he's here, but if that came to it. But, yeah, I would rather he was here, in all honesty.
I think, Chairman, Amy's absolutely right. I think in this, I hear what you're saying, Steve, but my absolute priority, to be clear on this one, would be safeguarding the individual child or young person. So, whether the family needs to isolate, how we would do it, all of that stuff will be worked through very carefully with public health first, and we'll be in touch with individual families. You have no doubt about that. But for me, on this particular issue, safeguarding is number one, in terms of putting people's back into isolation again, and the disruption to that is number two. It's got to be a safeguarding matter first, I'm afraid.
No, I completely agree on that. I just think that there's going to have to be each individual family, they'll have to sort of how they could deal with it appropriately, because you can avoid it.
Exactly.
You don't want a whole household isolated if you can help it.
I think, Chairman, that's why leave it with me to pick it up. And for me, each one will be different and bespoke. There'll be people who can come home anyway because they're not positive. And we're not talking about massive numbers here, as one hopes. There'll be families that are quite happy for the child to remain where they are, and the parents are quite happy for that. There'll be times when the parents want to go to the mainland and to stay, and there'll be times when we need to bring them back. And I think each one of those cases is going to be unique and special.
Okay, thank you very much for that, Paul. So we'll move on to agenda item 5, which is our communications monthly update in the hands of Tom Walton. Thank you, Tom.
Thank you, Chairman. Tanya, Whitney and Paul have done a really good job. They've touched on most of the main topics, so I'll be fairly brief. But one of the things that Paul highlighted is a big bit of communications during lockdown is obviously businesses and business support. So a lot of the business ratepayers in the island will be hearing from Cornwall Council's finance team over the next week or so to find out if they're eligible and how much they're eligible for in terms of support during the lockdown period, because it's been, another lockdown. It's obviously having its effect on businesses and residents. Something that the chairman picked up in his recent statement. We're also drawing people's attention to the Hardship Fund, which is led by the Edward MacDonald Trust and is supported by other trusts on the islands. This is for individuals in particular need of support. If they're having trouble buying food or heating their homes, we really do urge people to access that funding. And I know that the community services element of the council is putting together the winter support package, which won't necessarily be financial support for people, but other things that the council can do to make everyone's lives a bit easier, childcare support, that kind of thing, things for people to do, etc., over the winter months. Because, as mentioned earlier by everyone, whilst vaccines are sort of on the tip of everyone's tongue, Councillor Sims kind of summed it up. We need to carry on as if the vaccine isn't here for now, because otherwise the lockdown won't work and we won't have the restrictions eased come December. Everyone's really excited about it. It is exciting news, but the lead-in time, we don't know how long it will be in practice, and we don't know how instantly it will be able to ease restrictions. So, it is important to bear that in mind, and we've got a few months of winter left, so we need to bear that in mind. In terms of regular communications, we're starting to put out more paper communications. We know that people want that, and we can't always write to every resident on the island, so we've started to print the chairman's statement, which is the main summary of COVID comms that we do each week. We try to cover the main issues. If the board ever feels like we're not covering something that they're seeing in their communities or on their islands, please get in touch. I'm sure Robert or I can just make sure that appears in the chairman's statement at the end of the week. We do want to cover every issue that's of use to the public or things that might be a point of confusion for the public. It's a really good way of getting the information out there. Currently, we're only putting it in the post office and in the newsagent, but we'll look to try and get copies to the off islands as well, so that there's paper versions available there. We recognise we've not done that yet. The MailChimp email subscription account, which Councillor Lakes raised before, it's up and running and we're testing it. It's a matter of days before we roll it out. Probably next week, in reality. There's a few things we want to test on it first, but yeah, that should be up and running. It's another channel of communication for people to access, so they don't just have to go to the website or on social media. If you prefer email, you'll be able to get most of our council messaging straight to your inbox once that's set up. And on the topic of the website, we're reviewing all of the COVID web pages because over time, and particularly on the Isles of Scilly, some of the information can go out of date a little bit. So we gear up, for example, in August with a lot of communications targeted at visitors, and what we're doing is we're taking some of that information down, we're amalgamating other bits and trying to give it a bit more of the sensible structure. So that's what we're in the middle of doing at the moment, and we think it'll be a lot easier for people to navigate once we're finished. And it'll really help when there's specific bits of information we have to roll out about, for example, vaccines. It'll have a home on the website, and we'll be able to get some really clear messaging for the public on that. Other than that, everyone's done a really clear job. I think Tanya's right. We did an exercise last week, which was very useful from a communications point of view. It was one of those scenarios where there's ambiguity on how much information you could release in the scenario or not release, and it was really useful to go over those points of potential confusion should something happen on the islands. And we continue to practice these scenarios, so things are going well from that point of view. And that's it for now. I think we've covered all the main comms issues.
Thank you very much, Tom. Councillor Grottek, please.
Thank you, Chair. Tom, I was glad to hear that you were going to communicate, as a matter of urgency, some more information about grants. Something a little bit alarming happened yesterday evening. I was contacted by a local business to say that they had been phoned up, as they said, by someone purporting to be from Cornwall Council in St Austell, that they might be entitled to more grant. And since they were very wary, they phoned their accountant. They did have a mainland accountant some distance away, I understand, and he said, be very careful, it may well be a scam. So obviously we have to find some way of reassuring and making sure that people understand that this may well happen, and if so, it's effectively appropriate. Thank you.
Good point, thank you. Tom?
Yeah, thanks, Councillor Grotted. That's, we did put out some comms sort of preempting this so that, people wouldn't feel like it was an unsolicited call, but it's really useful that you've raised that because we can put out more communication this week to encourage people directly or, to remind businesses they may know who might not have access to social media just to, be aware that these phone calls should be expected and they are legitimate. What I wouldn't want to do on the call is say every call that you might get is legitimate. So what we can do is put some communications out of what you need to look for, what you need to listen for from the person phoning to know that they're making a legitimate call. They'll know aspects of your business, etc. If people feel comfortable, though, there is a phone number. You can listen to what the person has to say if they've called you, and then you can politely say, "Would you mind if I phoned you back?" Because there is a phone number people can dial and go directly through that route, and that will sort of ensure that you've got the right person on the other end. So we'll address that either today or tomorrow just to make sure that people know that there's a route to sort of legitimise those calls.
Okay, thank you very much. Councillor Sims, please.
Yeah, just a quick one. Read comms in general. All the hate seems to have gone out of these sort of fairly spurious statistics that people were finding about cases here and things. Now, they must be still coming up, but it doesn't come up on Facebook anymore. So I think that's done a fairly good job on nailing that. I've not seen anything now for at least 2 weeks, which is brilliant.
Okay, thank you very much. Any other comments, please, to do with comms? Okay, thank you very much, Tom. I'll now come on to item 6 on our agenda, which is to ask if anyone has any other issues they'd like to bring to the attention of the Outbreak Engagement Board, please. Dale Clark. Thank you, Dale.
Thank you, Chairman. It's nothing really important. It's just a quick one for Paul from the last meeting when we mentioned about QR codes at the airports and stuff. And I know that we had them here on St Mary's, but I didn't have sight of any at Land's End. He mentioned he was going to follow up on that. I just wondered what the result on that was.
Yeah, I did mention it to Stuart, Dale, and actually when I went there myself the second time, they were being displayed when I went a couple of weeks ago before lockdown. But I think I think the point that Whitney made was sometimes people have got them in prominent places and sometimes people haven't. You have to look for them. But I'll keep to reinforce that message every time I go, or well, we can all do it every time we go around and have a look. But they were definitely there the last time I went to Land's End Airport.
That's grand. Thank you, Paul.
Thank you. Any other matters, please, anyone would like to bring forward? No, well, thank you very much. Before we close the meeting, though, from the chair, I would just like to say that although it's obviously very good news from Whitney that we don't appear to have any currently on Scilly, we must do our bit as the engagement board and any members of the public listening to this meeting to ask that we do spread the word still that we have got to look out for the and follow the guidance from the government during this lockdown and make sure that we do abide by it we can all do our bit to try and reinforce that, because it's very easy for people to be casual about this and say, oh, we haven't got any cases here. But if we are casual, we will get some cases here. And we obviously don't want that. We want to stay in the situation that we're in. So I would ask that you could all do your bit, please, and making sure that everybody is aware that we need to follow this guidance. Thank you very much for that. Councillor Grottick, did I see your hand up?
Just to mention, Chair, that it might have been a legacy hand, but Councillor Sims had his hand up.
Yeah, I think that was a legacy, Steve, wasn't it?
Well, it was so I could talk about the comms thing, yeah. So, yeah.
Yeah, thank you. Okay, well, unless anybody's got anything else, I don't see any other hands up. So at this juncture, I'd like to thank you all for attending, and I will now close the meeting.